In India, it contributes about 1/5 of the global cervical cancer burden, and every year 1,23,907 women get diagnosed with cervical cancer, and more than 70,000 women get died because of cervical cancer. So here is the need of an hour that every woman should educate herself about cervical cancer, how it is going to transfer in their body, how the symptoms are there, how they will diagnose themselves, and how they will prevent it. Okay, so what is cervical cancer? See, in our body, every cell undergoes division. Okay, so what type of division is there? It is a mitotic and meiotic division. I am going to give you some scientific approach behind this. So mitotic division is mainly responsible for the cancer formation. Every cell divides itself into two. Like one cell will become 2, 2 will become 4, 4 will become 8, 8 will become 16, 16 will become 32. This is the normal scenario. But apart from this, if one cell becomes 10, 10 becomes 100, 100 becomes 1000, that is something abnormal division in our body, and that is cancer. Okay? If this cancer pathology happens in breast, that is diagnosed as breast cancer. If it happens in uterus, that is uterine cancer. If it happens in ovary, that is ovarian cancer. And as I previously said, it is the fourth most common, that is in cervix. Okay, so what are the three most common cancers in women? One is breast cancer, one is uterus cancer, one is ovarian cancer, and the fourth most common cancer is cervical cancer. So cervical cancer, as the name suggests, abnormal formation of the cells in the cervix area of our reproductive system, that is called as cervical cancer, and these abnormal cells are called as dysplasia. So in the histopathology, or once we get a tissue from that cervix area, what we are diagnosing, what kind of abnormal cells we are diagnosing whether the dysplasic changes are there or not. Okay, so let us go in the deeper concept of cervical cancer, but before that we need to understand what is the female reproductive system, where it is actually located, how is it. So this is the female reproductive system. I have a model with me also, I'll show you. So in this, the first number is vagina. Okay, so from the external part we are going towards the internal things. Are you able to see this thing? Okay, so this is the one number, that is vagina. Vagina means main sexual intercourse organ, which gives actual pleasure to partner. Okay, so that is their function. Then second is the cervix area, which we are going to talk about today. Then the third is uterus, third is endometrium, then the fourth is ovary, fifth is fimbriae. Fifth is fimbriae, means the end portion of the fallopian tube is called as fimbriae, from where the ovum picum will happen. Sixth is fallopian tube, and the seventh one is uterus. Now in this all female reproductive system, cervical cancer can happen here. Okay, there are other cancers also, like ovarian cancer can happen in ovary, uterine cancer can happen in uterus. Okay, now what is the main function of this cervix? Cervix is actually neck of the uterus. It is the security guard of the uterus. Whatever content from the outside, like from outside means what? From the vagina, if any content want to introduce into the uterus, it has to pass through cervix. Any content which is delivering from the uterine cavity outside of the body or outside of the vagina, it has to pass through the cervix. So cervix is the main gatekeeper. Cervix has lot of endocrine glands in it. Cervix has the main function that it controls the internal exchange mechanism between the uterus and the vagina. Okay, so the first exchange is of menstrual cycle. As you all females, you know that every 28 days you are getting menstruation, that is for the 5 days, and the entire endometrium which is shedding off, it is coming out through the cervix only. Okay, then the second important function is of the cervix is the fertility. If you are having good cervix, means good means healthy cervix, you will get more intimacy during the sexual intercourse. Then the third important function, of course, it is the pathway for the child labor, that is for the pregnancy and the childbirth. Both of the things can be carried out with the healthy cervix. Now this female reproductive system is situated like this, and this is the cross-sectional view of that area. So here you can see the vagina portion, cervix portion, uterus, endometrium, ovary, fallopian tube, and the fundus area of our body. If we zoom this cervix, it looks like this. Okay, and again, if we see this cervix from the vagina portion, then it looks like this. If we see through the vagina, how the cervix looks like this. It's a you know that fig anjeer type of thing, same, and inside that hole is there. Same type of pinpoint cervix is the normal cervix. Of course, if any abnormality, means it is not directly cervical cancer. There are n number of pathologies which also happen in cervix area. Like most common is cervicitis. Many of the females have white discharge. Many of the female have foul discharge also. During menstrual cycle also it get irritated. Due to multiple pregnancies it get irritated. So cervicitis type of picture is there. Itis means inflammation. Like we have eye infection, what we call it as conjunctivitis. We have sinuses, if inflammation is what we call it as sinusitis. Likewise cervicitis. Okay, now let's move to the further detailing of the topic, that is what are the causes of cervical cancer. Now I'll give you one retrospective study. Retrospective study means what? See, one research was done that many people got lung cancer. Okay, like let's say 1 lakh people of lung cancer, they are asked how you got this cancer. Then more than 90% people said that we were smoking since 10-15 years, that's why we got lung cancer. So